afternoon, everybody. My name is Mark Richardson. I'm the Director of Sales with Strategic Healthcare Programs, and it's an honor to be a platinum sponsor at the McKesson show. Hard to believe we've been coming to the show now for a decade, and have had a chance to meet with a lot of our existing clients out in the lobby. And for those of you that are not familiar with SHP, I'm going to provide a very high-level overview of how we directly work with McKesson and how we take data to a whole other level. And for those of you that are clients already, you're going to see some pretty exciting updates of things that we're releasing, or have released. So the idea behind the SHP platform is that we're providing real-time, actionable data designed to improve outcomes, revenue, patient satisfaction, and overall efficiency throughout your organization. And the way we do that is we're providing actionable data that's swept immediately from the McKesson system. So you have clinicians out in the field that are filling out their documentation. As soon as that data hits the McKesson side, our system sees the information, we sweep it, we scrub it, analyze it, and notify you of anything that's going to impact you negatively. So if you're losing revenue, if your outcomes are going to decline, if your risk adjustment is suffering, you're not finding out about this way after the fact, you are being notified immediately. The McKesson interface is a very McKesson-specific interface. This is not a canned interface that goes out to every vendor. We certainly do interface with quite a few vendors. McKesson has worked very closely with us to ensure that this is a seamless interface, and it's been so now for over 6 years. Again, there's nothing on the client side. Once we activate an account and connect it to McKesson, you are now in a real-time environment to make sure that you're improving. SHP has the largest benchmark in the industry, and we know why that's important. Benchmarking is not new to anybody. We know it's important to know how you're comparing. The difference within our system is that you have real-time benchmarks. So not only can I go up and pull up my agency and see how I'm doing today, I can see how I'm comparing to my peers at a regional, state, and national benchmark, and that's updated every single day. So there's never any surprises. The data is CMS risk adjusted, so you're not looking at just the outcome, but you have a risk adjustment to know, is this something we need to improve? And our clients use this as part of their daily and weekly review. If it's early in a quarter and there are outcomes that are not going to look good on Health Compare, we give you all the information you need so that you can quickly make changes before it's too late. So we empower all different levels of management, whether you're a CFO, a CEO, if you're a clinical manager that's monitoring a team, you have a dashboard appropriate to what you need to be looking at. Once you set this up, and it's really easy, it's all point and click, you just choose what you want to monitor, and you have real-time actual data. So this example that I'm showing up on the screen, this is a clinical manager that wants to look at their staff. And there's no need to have all hands on deck meetings. If you have 1 or 2 clinicians that are struggling, you know exactly which areas they're struggling, and you can sort of fine-tune your education to just work with those that need the help. Some advanced functionality for those that are already clients, you can now click on these widgets and set your own goals. So let's say you open this up and you realize, wow, our pain outcomes really declined in the last month. You can set your own goal. So you just set a percentage, you say, SHP, I want to be notified anytime I fall below this percentage, and we'll send you an alert. We integrate patient satisfaction, and we are the only system that automates that whole process. So you don't have to have your staff send us a list of names and addresses. The McKesson interface knows when a patient's ready for the survey, so we sweep the name and address out. It goes out automatically, so it's all behind the scenes. And we're tracking patient name and clinician. So if there's a care issue and you want to know about it today, you're going to see an assessment, or a survey if it came in today. You know who the clinician was that cared for the patient, who the patient was, and we even tie that data to the outcome information. So a great example is often we'll notice specific process measures aren't being met, and then we'll find a direct correlation with those patients having lower satisfaction scores, which is an easy fix. And of course, comments are always there. You can read the handwriting just by clicking on the patient. We have a fully integrated system that's identical on the home care side to hospice. So anyone out there that's providing hospice care, HIS, QAPI, HQRP data, it's all being swept. There's no manual data entry. So it's really plug and play. You flip a switch. and you have real-time data and benchmarking. And of course, you're not just looking at scores, but there's accountability and transparency. So if you're wondering what's going on, you can drill down to the staff, you can see who your star performers are and who needs help. We have evolved our clinician scorecard over the years, and we don't take full responsibility for this. We have a lot of amazing clients that give us great feedback and what's working and what's not working. And we've developed a scorecard which takes all the emotion out of doing performance review. So if you have to sit down with staff, it's not one person's opinion against another. It takes all the emotion out of it. I mean, you can actually show them in a color-coded scorecard where they're doing well, where they need to improve. And it's comparing them to the rest of the staff. So they're not being singled out. They know exactly where they can improve. And clinicians want to provide excellent care. It's very difficult for them to get this kind of data. So if it's an annual review, you can run this for 12 months. If it's a new staff member and it's a probationary period, you can run it for a month. Make sure that they're coming up to speed. Or integrated alerting, again, I kind of covered this in the beginning, but it's actionable data that comes to you, so you're not having to upload files to us and wait for a response. Every hour in the hour, we're sweeping data from McKesson. Anyone that's set up to get alerts will get them. So you can get them on your device, email, wherever you want those sent. We don't just look at clinical components. Of course, this is not a tool to game the system. I get that question all the time. Like, is this legal? Can we do this? We always look at exactly what should be told. We want to make sure the picture you're painting to CMS is accurate. It's a true reflection of the care being provided. And an end result of that, clients always notice their revenue going up. If you look at all of our clients, the average client sees about 1,000% return on their investment. And when you look at an alert, not only can you see the clinical issue, you can drill right down to the financial impact. So I know, okay, this is what we need to do, and wow, we're going to make $500, just by making this one change. I'm certainly not going to go into every little report that we provide today. I just want to keep this very high level, but for those out there that are data geeks that like to get into the data and find out what's going on, you can slice and dice any way you want. So you can filter reports by diagnosis or by referral. Let's say you want to look at all your referrals and see who's sending problematic patients or which patients are profitable. That's data that we sweep right out of the EMR. Enterprise level reporting, same thing. So either you can focus on a branch or look at your system as a whole. And HH caps is included, so we never charge anything extra. That's part of the offering. One last thing that I'll end on is the telehealth reporting. I know that telehealth right now is very, very important. Cardiocom, who was just up here speaking, we have an amazing interface with them. You have that ability in real time to see telehealth versus non-telehealth outcomes. So if I want to see if it's making a difference in keeping patients out of the hospital, that mystery's gone. Or if I'm going to go and talk to a referral source and I want to share with them our performance, I can actually pull data just on patients that they've been referring to me. So I can have a meaningful discussion and show, look, we've implemented telehealth and it's making a really big difference. So that's it. If you guys want more information or you want to drill down even further, please come see us at our booth. I'm flying out of here tonight, but Robert Backlund, who's over here, will be at the booth, so please come and visit us. Thank you.